Has someone close to you begun to show small but concerning changes over the past year? Many people think that death in old age comes suddenly, but in reality, the body often gives quiet signs months, or even a full year, before life reaches its final phase. The issue is that most people miss these signs because they seem so minor at first. Only later, looking back, do families realize the signals were always there. But by then, it is too late to plan or create meaningful final memories. In this video, we are going to explore 5 important signs that can appear up to a year before an elderly person passes away. Some of them may be things you have seen but ignored as normal aging. Others may seem unimportant, but actually show that the body is slowly wearing down. Spotting these signs early lets you give better care, share deeper moments, and, most importantly, help your loved ones spend their final stage with comfort, respect, and peace. Stay with us until the end. These 5 signs can help you be ready both emotionally and practically for what is coming. When you understand what is happening, you will not be caught by surprise. Instead, you will make the most of the time that is left with someone you care about. Let us begin. Number 1. Noticeable weight loss. One of the first and clearest signs that a person might be in the last year of life is losing weight without trying. At first, it can be hard to notice. Belts needing extra holes, clothes fitting more loosely, or someone not finishing meals like before. Many families think this is just another part of aging, but losing weight without a reason is rarely a good sign. It often means the body is not using nutrients properly, muscle is shrinking, and major systems are starting to slow. It is natural to lose a bit of muscle with age, but when it happens quickly, it can mean something more serious is going on. The body may not be breaking down food well, or may be unable to use protein effectively, causing muscle loss. This drop in strength not only makes moving harder, but also raises the chances of falling, lowers the immune system, and makes the body weaker against illness. Another cause of weight loss in the final year is a change in appetite. Older people may no longer feel hunger like they used to. Their taste fades, food becomes less enjoyable, and they may skip meals or eat very little. This is more than just a change in preference. It is a physical shift. The body starting to shut down, stops signaling the brain to ask for food. This leads to less energy, less power, and a slow decline in overall health. Also, there is the effect of ongoing medical issues. Weight loss is often linked to long-term illnesses such as cancer, heart failure, or kidney problems, conditions that may begin progressing quietly long before strong symptoms appear. Even mental health changes like depression or memory loss can lead to eating less, putting the body in a downward cycle where it does not get the energy it needs. Some families try to help by offering more food, favorite meals, or adding protein drinks. But if the weight still drops even with these efforts, it is important to understand that the issue is not just eating. It may be the body preparing for something deeper. At this point, pushing big meals may not work. Instead, choosing soft foods, easy snacks, and keeping them hydrated can do more to keep them comfortable and stable. If you notice a major drop in weight in an elderly loved one, especially if they are eating less, feeling more tired, or finding it harder to stay active, it is time to take it seriously. This is not only about appearance, it is a signal from the body, and understanding it now can help you face what is coming with understanding, care, and the chance to make each remaining moment matter. Number 2. Ongoing tiredness and lack of strength. A common change seen in the year before the end of life is a deep, lasting tiredness that does not improve with rest. This is more than feeling worn out after a busy day. It is an intense fatigue that makes even simple things feel difficult. Getting out of bed becomes harder. Walking across a room feels like effort, and basic activities like preparing food, getting dressed, or having a short talk can seem exhausting. This is not just about aging. It shows that the body is trying to hold on to its energy as its internal systems begin to slow. The heart may not pump as strongly, blood flow may weaken, and muscles may not receive as much oxygen as they used to. That is why many older people in their final months begin to feel more fragile, less steady, and unable to keep up with even small daily routines. Another major cause is the body's slower energy use. Normally, the body creates and uses energy for daily tasks, but during this phase, it begins to save energy instead of using it for movement. That is why someone going through this decline might sleep more, need extra naps, and have trouble staying alert for long stretches. In some cases, their energy may suddenly drop. They may appear okay at one moment and then feel totally drained the next. One of the hardest parts of this change is how it affects emotions. Many older people who were proud of doing things on their own begin to feel upset or ashamed when they cannot anymore. They might pull back from conversations, skip social visits, or stop enjoying activities, not because they do not care, but because they just do not have the strength. This may lead to loneliness, where they stop trying altogether, and that speeds up their decline. For families, it is tough to see a loved one go from active and social to tired and distant. It is easy to think they are not trying hard enough, or that they just need encouragement, but pushing them will not help. The most important thing is to respect their limits, let them rest when needed, and focus on keeping them comfortable. If you see a loved one facing deep, ongoing tiredness that rest does not fix, take it as a clear sign that their body is going through big changes. This is your moment to have calm talks, share peaceful times, and support them without putting pressure on what they can do. In the end, what truly matters is not their activity level, but that they feel cared for, supported, and calm. If you are still watching and feel this message has helped, please type number 2 in the comments to let me know. And if you have not yet subscribed, I encourage you to hit subscribe and turn on the bell icon so you never miss an update. Your support helps us continue to share thoughtful and helpful content. Now let us continue. Number 3. Clear mental confusion or pulling away. As someone nears the last part of life, you may notice big changes in how they think, speak, and connect with others. A person who used to be cut off, but ready for the next section, sharp and alert, begins to forget more frequently, struggles to keep up with conversations, or appears lost in places they have always known. They might repeat things, forget familiar names, or lose track of time, even if memory problems were never an issue before. These slight mental changes can appear several months or even a full year before passing. This is not simple forgetfulness. Just like every other organ, the brain needs a regular supply of oxygen and nutrients to work properly. But as circulation slows and oxygen to the brain reduces, thinking ability begins to decline. The person may become confused more easily, have trouble making decisions, or fail to recognize people and places that were once very familiar. In some cases, there can be short periods where they seem completely aware, followed by sudden confusion, almost like their mind is switching on and off. Another common change is emotional withdrawal. A person approaching life's end often stops engaging socially. You may find them talking less, interacting less, or spending long stretches just sitting quietly. It is not because they do not care about others. The brain is simply no longer processing emotions and social interaction in the same way. Talking can feel like a lot of effort. Noisy surroundings might feel too much. Over time, many older people start to drift into their own inner space. Mood and behavior can also shift. Some may become more short-tempered, nervous, or easily upset. Others might appear oddly calm, distant, or uninterested in things that used to be important. These are not just mood swings. They often reflect the brain adapting to the body's overall weakening. As thinking slows down, emotions become harder to show. The person may stop reacting to things the way they once did. For family members, this can be one of the hardest parts, seeing a loved one slowly lose their connection to reality or pull away emotionally. It can feel like they are already gone, even when they are still there. But this is not something they are choosing. They are not able to control it. Instead of trying to pull them back into conversations or activities, the best thing you can do is be present with them. Speak in a soft tone. Offer comfort. Know that even if they do not always reply, they can still feel your care. If you see a loved one becoming more forgetful, more confused, or withdrawing emotionally, do not brush it off. These are often signs that both mind and body are starting their final transition. This is a time to stay calm, enjoy quiet times together, and create an atmosphere that feels safe, warm, and familiar. Because even when communication becomes difficult, love and comfort are still deeply felt. Let us continue. Number 4. Recurring infections and delayed healing. As the body begins to slow down, one of the most visible physical signs is a weakened immune system. You may notice that someone who almost never got sick now catches every cold, flu, or small infection going around. What used to be minor illnesses now take longer to recover from. Even small injuries, like a little cut or bruise, seem to heal much more slowly. These are not random changes. They are clear signs that the body is no longer able to defend and repair itself as it once could. One of the major concerns is repeated infections. Pneumonia, urinary tract infections, UTIs, skin problems, and even infections in the mouth become more frequent as the body's defense system gets weaker. Many families believe these are just random illnesses, but when they start occurring often or take a long time to heal, it usually means the body is struggling to defend itself. Even antibiotics that used to work quickly may not seem as effective anymore. The person might need stronger drugs, longer healing time, or several treatments for infections that once seemed minor. This happens because as blood flow decreases and organs slow down, the body does not react to treatment the way it once did. Another often missed problem is wounds that do not heal. If you see small cuts, sores, or bruises taking too long to recover, or reopening again and again, it may signal that blood flow is not reaching the skin well. Without enough oxygen and nutrients, healing becomes much slower. Bed sores, especially in those who move less, can turn into serious problems and lead to harmful infections if not looked after properly. What is even more troubling is that infections in the last year of life often do not show typical signs. Instead of having a high fever, an older adult might just seem more tired, confused, or not want to eat. In fact, for many elderly people, a sudden drop in alertness is one of the first signs of an infection, even before anything else shows up. That is why noticing these changes early can help improve their comfort and care during this final stage. For family members, watching someone go through infection after infection can be exhausting and deeply upsetting. It is natural to hope that one more dose of medicine or another hospital stay might turn things around. But after a point, the focus often shifts from trying to cure to simply offering comfort, helping them stay hydrated, keeping their skin clean and soft, and reducing strain on their body may help more than more medications that only stretch out the discomfort. If you are still with us and found this part helpful, type number 4 in the comments so I know you are here. And if you have not subscribed yet, make sure to hit the button and turn on the bell icon so you never miss a video. Your support helps us keep bringing helpful and thoughtful content for you. Now let us move ahead to number 5, major shifts in breathing or circulation. One of the clearest signs that the body is reaching its final stage is a visible change in how the person breathes and how blood moves through the body. You might notice your loved one taking slower or shallower breaths than usual. Sometimes, they may pause between breaths, or their breathing might become uneven, quickening and then slowing without warning. Some people develop a breathing pattern called Cheney-Stokes respiration. It is where breathing goes back and forth between deep, fast breaths and long breaks. These changes may start off small, but tend to become more obvious and more regular as time goes on. Another common indicator is reduced circulation. You might notice that their hands, feet, or even their nose and ears start to feel cold when touched. The skin may look pale, bluish, or mottled, especially around the fingers and toes. This happens because the body is directing blood flow to the vital organs, reducing circulation to the outer parts. It clearly shows that the heart is not pumping as strongly as before. Some people also experience increased shortness of breath, even with little movement. Just sitting up, talking, or changing position may make them feel breathless. You may see them breathing through their mouth more often, or they might suddenly pause to catch their breath while speaking. If they used to walk across the room easily, but now find it hard, their lung function might be weakening. In some cases, fluid building up in the lungs makes breathing even harder. This can cause a constant cough, gurgling noises, or a tight feeling in the chest. Many assume it is just congestion from a cold, but in older adults nearing the end of life, it is often a sign that their lungs are failing. This can make lying flat uncomfortable, so they may prefer sleeping with pillows propping them up or sitting in a recliner to breathe easier. For family members, seeing these changes can be scary. It is natural to want to help by encouraging deeper breaths, or to worry that something urgent is happening. But often this is simply the body's natural way of slowing down. There may not always be a way to stop these changes, but there are ways to make the person more comfortable. Keeping the room cool using a humidifier or offering small sips of water can ease discomfort. Sometimes medication or oxygen therapy might help, but the focus generally moves from fixing the problem to providing comfort. If you notice these signs, changes in breathing, cold hands and feet, or a bluish skin tone, pay close attention. These often mean the body is saving energy and circulation is slowing down. It is a time to be present, offer reassurance, and create a calm space where they feel safe and relaxed. In these last months or weeks, the most important gift you can give is not medical treatment, but comfort, dignity, and the knowledge that they are not alone. Final thoughts. As we reach the end of this video, take a moment to think about what we covered. Significant weight loss, extreme tiredness, cognitive decline, repeated infections, and major shifts in breathing and circulation. These 5 signs often show up in the year before an older person passes away. They might not all happen at the same time or be easy to spot at first. But when you start seeing them, it is a sign the body is getting ready for its final stage. For many families, accepting these changes is hard. It is normal to want to fight against them, to encourage a loved one to eat more, move more, or keep going despite fatigue. But sometimes the best thing we can do is listen to what their body is telling us. Instead of trying to reverse what is coming, we can focus on making the time left as peaceful as possible. Making the time left as comfortable and meaningful as possible is the goal. Understanding these signs is not about fearing death, but about being ready for it. When you notice these changes early, you can provide better care, make important decisions in advance, and help ensure your loved one's final months are filled with love and respect. This period is for treasuring moments, sharing memories, and letting them know they are important and not alone. If you see these signs in someone close to you, take a deep breath and remember you are not alone on this path. Many families have faced this before, and while it is never simple, knowing what to expect can give you strength, patience, and peace. Thank you for watching today. We would love to hear from you. Leave a comment below sharing one thing you learned and how you plan to use it in your life. Your thoughts matter to us, so please feel free to share. Reading your comments gives us great motivation and encouragement. If you found this video helpful, please like, subscribe, and share. Your support helps us keep making good content to inform and inspire you. Thank you for watching, and we look forward to seeing you in the next video.